Any more members? You notice, Alex? People. Let me do people.
Nope,
I've got Sam. Because right now I show 1, 2. I've got 4. As soon as we get one more, and then whatever comes first, 5 or 10 o'clock, to keep on time, Mr. Chair, given our hope that we can keep our schedule. Of course, we don't want to be inorganic. If we
Right.
just have a wonderful conversation, we'll do what we have to do. But hopefully we can keep it to a tight 90 or so.
Absolutely.
Just so you know, I know you'll ask again for confirmation when the meeting begins, but recording has been restarted and transcription is now going as well.
Karina, were you able to get the chat going?
Yes, I got it. I think it was my phone that was in airplane mode.
Okay, thank
I
you.
didn't realize. Yeah, thank you.
And I wonder, everyone, I think everybody's kind of meeting fatigued because many of our colleagues have been monitoring legislative sessions and committee meetings, and so we kept that in mind, and our agenda is not as heavy. It's not loaded to bear with a lot of presentations, but it's still very meaningful. But I know that might affect attendance, I think. People are just ready to take a break from this, I think.
I'm in trauma
Yeah, lots of
therapy
people are
because
still
of the session.
Trauma
Oh my
therapy.
goodness.
Oh no,
Trauma
Dr.
therapy.
Nathan. Oh, we won't add to your trauma. We will not be activating your trauma. We'll do our
So,
best.
yeah. So it's big change for us. Big changes. So
Yeah, and I don't want to get into the meeting, but yeah, interesting stuff.
mhm.
I think that's our fifth there.
Who joined? Nancy?
Nancy Bowen, I
I
believe.
see Miss Nancy. Good morning, Miss Nancy.
Good morning.
Oh, and Nathan's here, my PIO. Hi, Nathan.
Good morning. How are you?
Good morning. Nancy, how are things in your neck of the woods?
They are good. A little less work at the moment just because session has ended, so that's a good thing.
I don't know if you were probably in the process of joining. We have a light agenda in part due to meeting fatigue. So it's still very impactful, we believe. We think we have 2 very important topics to go over, but we are not going to overbear folks with additional presentations as we often do. So hopefully.
Yeah, I saw that it was a light agenda and I was like, but I was excited to hear like what the legislative review is. Because there are so many bills and I know that in our organization covers a certain amount, but you know, it's hard to focus on all of them.
Oh, absolutely. Absolutely. So we'll have a good conversation and dialogue, I think. Mr. Chair, it's 9:59. We do have quorum. Did anybody else
I would
join
also
you?
like to note that Angie Wilson has joined.
Yes. Hello, Angela.
Hi everyone, how's everybody?
We are well. Thank you for
Very
joining us
well, thank
today.
you.
Good to see you all.
Who I'm actually looking for too is Miss Flynn, Member Flynn. She mentioned she is our licensed doula. We love having her, and I really want her a part of the conversation. But she did alert us, Mr. Chair, that she is actually on standby for 2 birthing people. So
Correct.
doulas, they can't control their schedule sometimes.
Oh, it looks like she just joined.
Wonderful. Okay, let me see. Make my checklist. I see Bishop. I see Maggie. I see Nancy. I see Nicholas. I see Tiara. In fact, I think we should go ahead and get started, Mr. Chair. It's your call. But the 2 members that are not here, as we discussed previously, we do not anticipate. So,
Ready when you are.
all right then. Well, welcome. to the June 4th, 2025 Nevada Office of Minority Health and Equity, also known as NOMHE. This is our advisory committee meeting. My name is Tina Dortch, and I am the NOMHE program manager. And for descriptive purposes, I am a Black woman. I'm wearing a denim dress. I have my hair styled in loose waves, framing my face. My background consists of me sitting in an office setting with a plain white background, and the virtual NOMHE logo should be visible in an upper corner if you are watching this on a virtual screen. I am one of NOMHE staff that will be supporting today's meeting. Along with me, I do have Karina Fox and Ms. Alexandra Neal. Before we begin, Ms. Neal, can you please confirm that the recording for this meeting has begun?
Recording and transcription of the meeting has begun.
And may I also ask my interpreter, am I speaking too quickly?
No, we can sign as fast as you speak. Please go right ahead.
Thank you so much. And I'm also going to be mindful about transition. So I'm trying to learn and be a better partner. So let the record show that we are also supported, as I just mentioned, by American Sign Language interpretation, and that as well, you may use closed captioning. This is available and ready to use if it is a preference for you. This is a completely virtual meeting with everyone joining using our Teams platform. As a friendly reminder, we do ask that you silence all your phones. And for anyone who is going to be speaking, state your name each time you speak. Before doing so, just make sure you, before you are able to speak, and doing so will help us to accurately transcribe in the minutes. When not speaking, we ask that you just mute yourself. Each of our members of the advisory committee, we do ask that you keep your cameras on. Just unmuting yourself when you are speaking, but by staying camera on, it does allow us to be more engaged in a virtual platform. And if you could do so through the end of the meeting, we would be very appreciative. For any non-advisory committee members, specifically our presenters, make sure that you are doing so during public comments if you are not doing a formal presentation. And again, only engage your cameras while you're speaking. For those that are planning to give public comment, the chair will give you further instructions. Mr. Chair, you will be managing our agenda, and the agenda is yours. If you would please start by noting the time. You are ready to start with agenda item 1.
Thank you so much, Ms. Dortch. Hello and welcome to today's meeting. I'd like to call this meeting to order at 10:03 a.m. this morning, June 4th. So with that said, we would like to go ahead and start with our roll call. So for our roll call, would advisory committee members please acknowledge their presence when they hear their name called by our program manager, Ms. Dortch?
Thank you, Mr. Chair. Starting roll call with yourself, Nicholas Dunkel.
Present.
Dr. Samuel Hickson, our vice chair.
Present.
Angela Wilson.
Yeah, present.
Tiara Flynn.
Present.
Dr. Andrew Thomas Rias. He is an excused absence. Reverend Dr. Deborah Whitlock Lax. She is an excused absence. Nancy Bowen.
Present.
Bishop Bonnie Radden.
Present.
And Ms. Margarita Salas Crespo.
Present.
Mr. Chair, I'd also like to ask if our ex officio member, Legislative Advisor Senator Rochelle Wynn, has joined the meeting. We'll give a moment to see if she acknowledges. It appears she has not joined. And with that, Mr. Chair, we do have quorum. And I believe that you are able to go back to your agenda's opening remarks.
Thank you so much. As Ms. Dortch mentioned, I would love to open with some opening remarks here today. So first and foremost, I've got a couple of quick remarks, three to be exact. And the first is I would just like to take a moment to recognize a few of the different things that are happening this month, whether it be observation days or months. First and foremost, this month is Alzheimer's and Brain Awareness Month, so established by the Alzheimer's Organization in 2014. It's a month that's dedicated to encouraging global conversation about brain and Alzheimer's and other maybe potential forms of dementia. With that said, you are urged to wear purple as well as engage in any activities that might be happening in the community or with other advocacy organizations. With that said, it's also Men's Health Month, so please encourage the men around you to reach out. I know help-seeking behavior can be a thing that's a challenge for many of us, so we want you, if you're male identifying, to recognize that for yourself, and then also if you're around men as well, to kind of give credence to them reaching out for the benefit of their own health. It's also Fresh Fruit and Vegetable Month. This is something that can be lacking in a few of our different communities, whether it be, food deserts or food swamps. So an encouragement this month to advocate for eating of healthy fruits and vegetables. It's also Vision Research, Cataract Awareness, and Child Vision Awareness Month. So get those checkups in. Make sure you're taking care of your eyes as well. It's also Oral Health Month. So taking care of your oral health, getting into the dentist when you need to, whether it be yourself, your children, or those around you. And then finally, it's also Cancer Survivor Awareness Month. So this month is a time to celebrate the lives of cancer survivors, recognize their strength, and acknowledge the ongoing journey of survivorship as it pertains to these individuals and in potentially our communities as well. So these are the observations that are related to chronic disease and health awareness, but there are also a few different other observations that I'd like to recognize as well. First and foremost, this month is also LGBTQIA+ Pride Month. So this is a month to celebrate folks that are within these communities, the history that's behind these communities, and also kind of celebrate with them. One announcement that I'd like to make is that Las Vegas Mayor Berkeley declared June 14th, Southern Nevada Pride Fest Day. So this event will be happening that day. We encourage you, if you are in the South, to join in on the festivities. For Pride Month, Northern Nevada also does have some celebrations, but I am going to note, just so you're aware, that these are happening in September, not due to not wanting to celebrate, but more due to the heat and logistics. So please look forward to that in Northern Nevada in September. Juneteenth also takes place in this month on the 19th, both federally and at the state level. This is recognized and it celebrates the ending of slavery as well as enforcement of the Emancipation Proclamation. So celebrate that with folks that are around you, and also there will be events that are happening both in Southern and Northern Nevada around this time. Additionally, Father's Day is on June 15th, so please celebrate with your fathers and recognize kind of the work that they do in your lives and in the lives of their families as well. In addition to that, it's also National Great Outdoors Month and Camping Month. We're starting to get a little bit into the hotter temperatures here. We're having some beautiful, beautiful days. I know we were speaking about this earlier when we jumped on the call, but please get out there, exercise, be healthy, and really enjoy the outdoors. We live in a beautiful state here in Nevada. It's also Children's Awareness Month. And then in addition to that, it's also Care for Your Grandparents Month. So with that said, I know we've got a lot of different things going on for the month of June, but wanted to give light to a bunch of these different communities, dates, and awareness months that we are jumping into. So it's our hope that you will attend maybe the events that are going on, as well as maybe embrace one or more of these observations, potentially to make a difference in our communities or to honor those folks that are jumping in there. Now, in addition to that, I wanted to provide a bit of an update on the community health assessments. So with that said, there are 2 community health assessments that have been put out for the state of Nevada, both in Northern Nevada as well as Southern Nevada. With that said, these are documents that really kind of recognize community health impacts in our community, as well as things that we need to work on, maybe some potential resources that need to go out to our communities. With that said, these are things that I'm seeing in part with my work with Nevada Minority Health and Equity Coalition. This coalition is a partnership of academic, civic, and private community organizations that aim to address health disparities as well as inequities in Nevada. Our wonderful program manager, Ms. Dorch, sits on their leadership committee as well. And I would like to kind of urge everyone to take a look at these. They are the community health assessments. The one for Northern Nevada has been conducted by Northern Nevada Public Health, and the one for Southern Nevada is Southern Nevada Health District. These are now in implementation status beyond just kind of collecting the information. This is being something that is being actioned now. So with that said, I would like anyone who is here as a member of either the advisory committee or as a member of the public to take a look at those, learn a little bit more about our communities and see how we might support folks that do come from our community in these different areas. And then finally, with that said, I'd also like to remind our advisory committee members that our quarterly meetings are opportunities for us to provide feedback throughout the agenda. So for our advisory committee, we just wanted to give a timely reminder that they will be posting meeting recordings starting with this meeting, and that our meeting minutes will now be streamlined. We encourage you to interact throughout the course of this call, ask questions, maybe make statements as we go. And with that said, I'd like to go ahead and end the first agenda item with that. But I am noticing before we move on that a couple of folks have had their hands up in the chat. Bishop Radden, Tiara Flynn, and Ms. Dorch. I noticed that you all had your hands up, but I did not see who went up. So I wanted to go just in order of what I'm seeing here. So Ms. Dorch, I'm seeing you first.
Thank you very much, Mr. Chair, for really informative opening remarks. I do want the record to show that Reverend Dr. Deborah Whitlock-Lax has joined our meeting, if the minute maker can recognize that. And then, yes, there are 2 hands that were raised. I think Bishop is first, and then Ms. Flynn is second.
Thank you so much. Please proceed, Bishop Bonnie Radden.
Thank you so much. I also wanted to just make everyone aware, as a pool owner, it's a National Pool Drowning Awareness Month. I'm not exactly sure how they do that, but I just wanted to bring that to everyone's attention in that safety space, particularly right now. And also, it's a national month that y'all don't know, my birthday, June 30th.
Happy early birthday. Thank you so much, Miss Bonnie Radden. Next, we have Miss Tiara Flynn. Please proceed.
Yes, good morning. Thank you, Mr. Chair, and happy early birthday, Bishop. I was fiddling with my ring light, so I wasn't sure if we missed it, but I just also wanted to mention that it's PTSD Awareness Month. I would be remiss if I didn't mention it as a veteran. And then also it's SANS Awareness Month, which I just became, which is new to me, but it's for stillbirth and neonatal death.
Thank you so much, Ms. Flynn. And this is why I love coming together as an advisory committee. We come from many different disciplines, are aware of many different maybe months awareness dates that are happening in different issues within our community. So thank you both so much for adding to that. Welcome to our agenda this morning, Ms. Flynn, as well as Bishop Bonnie Radden. With that said, under agenda item 2, it's our practice to rotate reading of our land acknowledgement. So Ms. Tiara Flynn, you are our advisory committee member who would be reading the acknowledgement today. So with that said, I'd like to go ahead and turn it over to you for reading of our land acknowledgement.
Thank you, Mr. Chair. Again, this is Tiara Flynn for the record. For our land acknowledgement, the Office of Minority Health and Equity, as a program of the Nevada Department of Health and Human Services, acknowledges, honors, and respects the diverse and indigenous peoples connected to this land, and recognize the state of Nevada is situated on the traditional homelands of the Nuwu, Niue, Numu, and Washishu. We offer gratitude for the land itself, for those who have stewarded it for generations, and for the opportunity to work alongside our tribal partners. We encourage everyone in this space to engage in acknowledgement and continue learning about the indigenous peoples who work and live on this land since the immemorial, and about the historical and present realities of colonialism. Thank you.
Thank you so much for the land acknowledgement this morning, Ms. Tiara Flynn. With that said, we'd also like to go ahead and shift to our third agenda item here, the public comments. So I'm going to go ahead and read this off, and then once I have finished, please feel free to chime in. With that said, public comment will be taken during this agenda item. No action may be taken on a matter rather raised under this item until the matter is included on an agenda as an item on which action may be taken. The chair for the Advisory Committee on Minority Health and Equity will place a 2-minute time limit on the time the individuals may address the committee. The chair may elect to allow public comments on a specific agenda item when that item is being considered. To provide public comment telephonically, please dial 775-321-6111 anytime after the chair announces the period of public comment. When prompted to provide the meeting ID, please enter 493-836-655#.
Thank you, Mr. Chair. Alex, can you please help me monitor the chat, the phone line? Are there any raised hands for public comment at this time?
Mr. Chair and Madam Program Manager, at this time, there's no one who in attendance on the call who have raised their hands to be acknowledged and we have no one joining by phone at this time.
Thank you so much, Mr. Alex Neal. I appreciate your time. If you did not get a chance to phone in with a public comment or write in, we will have another opportunity towards the end of the call. With that said, we were going ahead and move on to the next item on our agenda here. So, Advisory Committee members, you were provided a copy of our February 11th, 2025 draft minutes, and they have been posted to NOMHE's website as required by statute. So this is for possible action. With that said, I'd like to ask if there's any discussion or any changes identified ahead of us making a motion to approve these meeting minutes as they stand.
Mr. Chair, this is Nathan Orm, Public Information Officer for NOMHE. Just one thing I noticed in using the agenda as the model or as the basis for the minutes, it still says agenda at the top of the draft minutes. So you want to change that to meeting minutes instead of agenda.
Mm.
Thank you so much, Mr. Orm. Nick Dunkel, once again, for the record, let the record show, please, that the changes will be made to the top of the agenda, or rather the meeting minutes, to revise from agenda to meeting minutes to better dictate which document we are looking at and which document the public may be seeing as well on the website. With that said, are there any other changes that have been identified by the advisory committee on these agenda item or on these minutes rather? Currently hearing and seeing none. With that said, I'd like to ask for a motion to approve the meeting minutes with the change dictated by Mr. Orm as well. Do I hear a motion to approve the minutes with that change?
So moved.
Thank you so much, Reverend Dr. Deborah Whitlock-Lax. Do I hear a second?
This is
This
Dr.
is Nancy
Samuel
Bell.
Hexon. I second.
I think we had a couple of folks chime in there, but I did hear Dr. Samuel Hickson second that motion. So with that said, I would like to make a motion or make a movement to approve these minutes and ask for all who is in favor to please say aye or raise your hand.
Aye.
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 All opposed, please say nay. Hearing or seeing no opposition, the motion carries. With that said, members, in addition to the new streamlined formatting of the minutes, now that they have been approved, a link to the full recording from the February 11th meeting will be added to the NOMHE website to augment the written minutes. Next, we turn our attention to agenda item number 5, which serves to inform the AC members of NOMHE's sustainability status. Program Manager, Ms. Dorch, would you please proceed?
Yes, thank you, Mr. Chair. As you mentioned, my name is Tina Dorch, for the record, Program Manager. And this is the section on our agenda, members, where we lift an informational item. This is about NOMHE's sustainability status. And I'd like to make sure that we discuss this so that in your role as advisors, you can basically carry out your statutory duty to review the manner in which the office uses our appropriated funds so that we are carrying them out to achieve the purposes of the office, and that you can also therefore make informed recommendations on activities of the office. So I think we can move to thank you very much, Alex. You have on your screen right now the abbreviated version of our budget report. Today's report is reconciled through May 12th of this year, and it reflects our state fiscal year, which actually is coming up to an end on June 30th of this year. And as of sine die, or June 2nd, the legislature's conclusion, NOMHE appears to be on track to maintain our funding, very close to its current levels. Final budget outcomes will be recognized after the governor does sign off on all of our state budgets, but we are very, very, we rest assured that it feels that we will be in a good position. Looking at the report, the first section that we talk about is what is our revenue source. And at any given time, NOMHE can have grants that are interwoven with our appropriated dollars. But at this time, we are not holding or directly receiving grant dollars. Our revenue source remains our appropriations through the tobacco settlement monies. And these are also known as Funds for a Healthy Nevada, or FHN. And you can see the amount for the funding period is for July 1 of 2024 to June 30th, 2025, again, our state fiscal year. And the awarded amount was $327,918. And that does reflect costs associated with personnel and our other operating expenses. As it is the case, we do ask from time to time for reconsideration. And the last legislative session, NOMHE did request one FTE position, but as were many asks of this nature in the last session, it was not approved. We were hopeful that because the position was funded not directly from tax funds, but instead from opioid settlement money or funds for Resilient Nevada, that might make a difference. The rationale, and I'm certain there's more, but what I can share with this body is that the state finds itself still dealing with a larger number of vacancies, and that our electeds felt that it was important to fill positions that are currently vacated before we start opening up new positions. So just a bit of context there. Just about reconciliation, what's been expended through the May 12th date. We've spent up to $261,807, which leaves our current balance of about $66,110. And between May 12th and the end of the fiscal year, June 30th, we are projected to spend $65,335, which leaves us with a projected balance at year end of 774, which according to my ASO is not a bad position to find ourselves. If there are any other questions about the report and the update that I've provided, Mr. Chair or members, I'm here to answer any questions I may be able to.
Thank you, Ms. Dorch. This is Dr. Samuel Hickson, for the record. I have a question in regards to the statement you made at the opening of your presentation regarding your renewal is close to your current standing. Does that mean that it's less or more? Because based on these numbers that I am looking at right now, and this might just be my personal bias, I know physicians that make more than your entire original award. So I'm curious to know how you and your department are expected to do what you need to do on such a minuscule budget. Again, going back to my original question of we are close to where we are now. So does that mean you are more or less than what you have right now?
Thank you for the question, Vice Chair Dr. Hickson. And I don't have last year's award in front of me, but I can almost from memory tell you it's almost dollar for dollar. So in some layman's terms, there was not much of by way of, say, a cost of living increase to your reference point. And as far as the budget of 317,000 for our operation and personnel expenses, if you are familiar with the history of the office, this is in keeping. Again, we have asked for modifications to the expenditures, and we were somewhat hopeful that because we were asking from a source that is a dedicated fund outside of the traditional appropriations, i.e. opioid settlement dollars, that we might see an uptick. But that was not the case. As I mentioned, many agencies and programs were in the same position to ask for funds, almost and a lot of them from the same funding stream, and we're given the same answer. So I think in order to answer the underlying question, it would really be better posed to those who are the decision makers and our elected officials as to the prioritization of the work of the office. I think, hopefully, this body knows we try to do a lot with a little. We try to demonstrate impact. We try to be intersectoral and support and lift the work of our sister agencies and programs. And quite frankly, equity has indicators that are not easily measured along traditional metrics, right? We know that everybody on this phone call knows that. So we strive and we work very hard. We update our governor quarterly on activities of the office. We do biennium reports. We have our meetings such as this. So we're very transparent in the work that we're doing. But again, we took a swing at it, Vice Chair, and we are very lucky in some regards that there were no cuts under other considerations. So given the climate and the environment that we find ourselves in, I think while we were hoping for more, we could have gotten less.
Thank you.
But I appreciate the question. Thank you, Vice Chair.
Thank you so much, Vice Chair. Dr. Hickson, Nick Dunkel for the record. I just wanted to recognize Miss Angie Wilson, who has raised her hand.
Thank you, Angie Wilson, for the record. I just wanted to make a statement. You know, I think I've been in coming on as a newbie to this group. I think I've been concerned about seeing how low this budget's been, and will continue to be a voice of support in that, because I too am alarmed at how small the budget is here. But I did want to just say this. I really genuinely appreciate all of the work and the effort that comes out of this department. I cannot express that more, especially on behalf of the tribes and for minorities in general, and just across the board in what the importance of this effort. And I will just say that, you know, it's alarming to see some of the stuff happening where, you know, DEI and those issues are, you know, being pulled back on a federal level. And I was a little worried about what this was going to look like for our state. And I appreciate that, even though there's not been an increase, where I certainly feel like an increase is necessary. The reality of the situation is I'm also really grateful that this program is still standing here today, and the importance of this program overall. And I'll continue to be a voice for that. I think it's really important as we move forward. So I really feel like sometimes these discussions or these, you know, the feedback, I want you all to be aware of how much it is appreciated in our state. And so I just wanted to make mention of that. And I'm really glad to see that, you know, these initiatives are continuing and that the governor feels like, you know, this is important. I'm glad to hear the quarterly update on all of the work happening out of this agency, and I'm in full support of it. So I just wanted to recognize the hard work that goes on behind that. And I'm sure the level of stress that we all feel at this time of, some of the things happening on the larger level and how that's impacting us at the state level. So kudos to you all. Keep up the great work, and I'll continue to be a champion for you where I can.
Mr. Chair, if I may respond, this is Tina Dortch, Program Manager. Ms. Wilson, it is an understatement to say that you have been an ally to this office. You're right, you are one of our newer appointees, and you have been very vocal. I'm not sure how much more could have been done under the circumstances, to be quite honest. But we did put forth the effort, and I just appreciate the recognition. You're going to hear and you'll hear more in August when we have our official, we call it our annual meeting, about how the office is really, I don't want to use the word reinventing ourselves, but just making sure that we're relevant in the current environment, and how even like the presentation that you're going to hear from one of our staffers later in the day on the agenda, how we are putting ourselves in places of relevance that still have a health determining impact. And that's the mission of this office. It's what we're intended to do. And I think because we can go back over time and show that our activities support that. And so I think we do have champions in the elected official rank and file. And I do appreciate each of them and their efforts, but it could have been a different outcome. While we hope for more, we are appreciative of where we landed. And even as I think about, you mentioned our support of our tribal communities, we are really dedicating our work on our, not just our tribal communities, but the larger landscape, be it our rural and frontier communities, right? And there's an intersection there. We have work that we're doing through Ms. Karina Fox, who will begin reporting as a standing item come the November agenda on the work that we're doing to analyze and effectuate positive change with our state's public health infrastructure. So again, that's a change, it's going to be a little bit of a change again to our agenda. So, we roll with the times. We try to stay relevant and still be meaningful and committed to our mission.
Thank you so much, Ms. Dortch, and for the other advisory committee members for your kind words, as well as your thoughts here. Are there any other potential comments or questions from the advisory committee members at this time? I'm currently hearing and seeing none. Ms. Dortch, actually I'm seeing Ms. Bishop Bonnie Radden. Please proceed.
Thank you, Chair. Bishop Bonnie Radden, for the record, I just want to publicly say that I believe that one of the greatest things that we have is a great leader in Ms. Dortch. And I just want to publicly say that. And I appreciate her gifts and the incredible human being that she is in this position as this leader. And I just want to publicly say that. I mean, there's so much I could say, but I think we need to acknowledge that.
Okay, I'm not going to start crying, Bishop. So I'm just going to say thank you. And Mr. Chair, I think I am still up on the agenda if I am looking at it correctly. But thank you so much, Bishop.
Absolutely. Thank you so much, Bishop Bonnie Radden. And just wanted to second the thoughts, Nick Dunkel, for the record. But again, just wanted to second the thoughts from a lot of our advisory committee members. Ms. Dortch, we appreciate all that you do. And considering, the budget that we're seeing here, as well as hearing the updates from you and your staff, you've been immensely adaptive in this time, working towards affecting change in the community, making an impact. And as Bishop Bonnie Radden said, you've been a real force and a source of inspiration for each of the advisory committee members here. So thank you so much for your adaptability in this space. And just wanted to, before turning it back over to you, a bit of a call to action to the advisory committee members. I know Ms. Wilson mentioned being a voice for NOMHE and for the work that's being done. We've heard a couple of examples of how effective and important this work is. So I just wanted to really kind of put that call to action out there. I'm sure all of our advisory committee members are forces in the community and are speaking on behalf of NOMHE in ways that are impactful. And I'd like to ask that we continue to do so. Things are changing. I've heard quite a lot of phrases such as, weathering the storm with these changes that are happening. At this stage, we're talking DEI and a lot of the work that's being done towards health equity. So as we're kind of working towards this work through NOMHE, and as we sit as advisory committee members on this board, I just like to urge my colleagues here to continue to be voices in our spaces for NOMHE and for the work that they do, because they are doing so much and being so adaptive through this space. I thank you, Ms. Dorsch, for being so optimistic and in mentioning that it could have been less, but I think I do share also the dismay of my colleagues that it was not more due to politics, for lack of better terms. So thank you so much for all of the work that you do. Ms. Dorch, I'd like to turn the agenda back over to you for updates on our mission-driven activities through NOMHE, strategic partnerships, initiatives, and also the status of actioning the action plan. So with that said, I will go ahead and turn it back over to you for our agenda item 6.
Thank you, Mr. Chair. This is Tina Dorch, Program Manager, and it's a portion of the agenda that I really like. I get to show off the work of the team. And yes, I have to cobble together my team. It's like a tapestry of keeping my team together, but this is an opportunity to show that when we come together and we have support through personnel, that we can do this work. And so let's just move into the update on our activities. And what we're going to talk about first is we just left a very important period for our office, and that was April of 2025, which is affectionately known as Minority Health Month. We had a very kind of lower key April this year. And to that point, we really tried to do more with less. We had one event. It was only in the South that NOMHE was responsible for coordinating. And then we had multiple events where we were partnering with some of our very, very resilient nonprofit partners. But under the category of those that were facilitated by NOMHE, we hosted something called National Healthcare Decision Day, and we taglined it Planning for Your Future. This is a date that is observed annually on April 16th, and it encourages individuals to plan for their future healthcare decisions. And they can do so with their family and or loved ones in mind, and they can also express their wishes to their care providers. And they do this addressing their needs throughout all of life stages. It's not just towards the latter part of life and those end of life decisions, but it's also about managing chronic diseases, perhaps by a younger person. How do you want that to look? And so this day allows individuals to pause and to think about how you document your preferences using vehicles such as living wills and power of attorneys and advance directives and do not resuscitate orders and provider order for life-sustaining treatment documents called POST. That's a hard acronym to say, POLST. But on April 16th, we were hosted at the United Way, Southern Nevada United Way, as a major partner for this activity. We brought together the Legal Aid Center of Southern Nevada, the Southern Nevada Senior Law Program, as well as the Nevada Disability Advocacy and Law Center. So as you can see from their names, it was legal representation across multiple demographics. And then lastly, we were very excited to have the Nevada Secretary of State be a partner as they talked to people and introduced them to their cloud-based lockbox, where all of these documents could be saved virtually, and that our care providers are able to gain access should a person come in incapacitated and unable to advocate on their own. So Also on hand, we decided, because we can't do anything without having a health intersection. We did ask the Asian Community Development Corporation to be there, and they have their own medical clinic. And we also had community health workers who we champion whenever we can, provided by Southern Nevada Health District. So while people were waiting to engage with one of the professional legal providers, they could have their vitals checked or learn more about ACDC's resources. Again, shout out to United Way, but also a huge shout out to our partners and our good friends with Real Media. One of the founders is our advisory committee member, Maggie, and she was able to help us promote that. We are also going to talk a bit about our tabling events with other partners. There were 3. Won't go into all the details about what they entailed for the sake of time, but we had one event on April 5th that was Bridging the Gap. And it's about awareness raising for adults with sickle cell disease. That's important because historically people think of sickle cell disease as being an affliction for people who are under a certain age, and usually that's pre-adulthood. And in generations past, sickle cell disease often had a very limited life expectancy, but now there's a lot of adaptations, and we have a very active support group that does work in that space, and we were able to partner with them. And the actionable outcomes were an increase in blood drive donations, able to raise again just general awareness. It's a family-friendly event. I mean, when you're dealing with a chronic disease like that, it's nice to have something pleasant to also take. And then for NOMHE's role, we were there to promote, as I always say, our sister agencies and resources specific to chronic disease management. The second event was Hope Glows, and this was hosted by our Nevada Donor Network entity on April 26th. For those who have been around for a moment, one of the pillar activities for NOMHE is the diversification of clinical trials. And so this works nicely and dovetails with that particular pillar of our activities. It was a wonderful event. It's a run-walk event. As the day winds down and evening and dusk starts to rise, people have their glow sticks and do a quick run-walk just to recognize and get people motivated to register as organ, eye, and tissue donors. And we are there to make sure that those registrations are very diverse, because oftentimes they are not. And so similar actionable outcomes just for this particular audience. And then the last event, just another demographic that we try to always be responsive to, and that is an event that was called Healthy Kids Day. And it was hosted by the YMCA, who has just become a great partner to us. That was also on April 26th. So thank goodness I do have enough team members. We were able to divide and conquer that day. And some of us were at the Nevada Donor event, and some of us were at the Kids Day event. This year, the Kids Day event had a safety feature. And Bishop Bonnie, you would be happy to know that it was called, I want to make sure I'm reading this so I don't want to get it wrong, but it was water safety. Safety Around Water, SAW, is a program that the YMCA is lifting, and they offer it free to the community. And at the Durango Hills YMCA Water Park, is where we held the event, and there were water safety demonstrations. And they talked about, Bishop Bonnie, how water issues and drowning in particular are the leading causes of fatalities and deaths in youth under the age of 12. Again, similar actionable items to achieve, but the safety component is really important. And I'm going to I think I'm going to keep going, Alex, and talk about the upcoming community outreach. I know it's a mouthful, but I think we can just go through it and then take questions at the end of this section, Mr. Chair. So this is an upcoming event. And again, for those who have been here, this is something we do annually. It's very important to us. It is the back to school fair, but it's really a resource fair with a back to school component. It's our 5th time. We're going to be once again at the invitation of the wonderful Fountain of Hope Church. We've joined with them. They The kiddos there, they get the backpacks, and we handle the health determining vendors. So it's been a great collaborative effort. It's July 26th, and again, we're going to be hosted at Cannon Middle School. So lots of family fun and things of that nature, but we also have a lot of resources and services that will be delivered that day. In particular, this list is just a very partial list of the vendors. Um, Puentes, who does amazing ground level work here in the South, the Nevada Department of Wildlife, Nevada Health Link, various programs from our sister divisions at DHHS, specifically coming from DWIS, DBPH, and ADSD. Our partners at UNLV are going to have their lead awareness program there, dental programs, the amazing program at Roseman University called the Genesis program, where they really are tracking families in a longitudinal way. The Promotores Las Vegas group, Intermountain Health, and then one of our newest MCO partners to join this activity is Molina. Again, special thanks to our partners at NRO Media, and also a shout out to Parametrics. Um, this is a non-traditional partner for us, but given that NOMHE is now pivoting to the safety space, they are providers of public safety traffic related materials, and they're donating hundreds of blinking safety badges to give out to the kiddos. So we're excited about that. And to the chair's point, and before I pause for any thoughts, I just want to say that we will be releasing the Hold the Date flyer following today's meeting, and we really hope that not just for vendor participation, but that our members, our advisory committee members, will get this in the hands of parents and kiddos. Um, um, again, it's going to be a great day. It always is. We just really do it to have bodies come through and people come through to take part. Just to take a pause, allow our perhaps our interpreters to switch off maybe, and to see, Mr. Chair, are there any thoughts or any feedback on what I've mentioned before we go into the next slide?
Thank you so much, Ms. Dorch, for the update. I'm seeing Bishop Bonnie Radden has their hand up. Please proceed.
Thank you, Mr. Chair and Ms. Dorff. Bishop Bonnie Radden for the record. I think you just said my question number one was how could we get this flyer, and you're going to get that flyer into our email box. And then secondly, you shared about all of these events and that you have individuals and you're trying to make it go. My question is how can we help you when these events happen in the community? I'd be more than happy to help to put my hands to it if I'm available, here in Las Vegas or surrounding areas. How can we help you if there's a thing that says you have not because you ask not. Well,
Yes.
so I'm making myself available.
Thank you, thank you, thank you. As I mentioned, when you do get the flyer in hand, the vendor community, those service providers, they're responsive, but there is so much competition for these activities. We just want to make sure that we get, and participation has varied over the years. We've had as low as, 75 people show up one year. We had close to 400 show up one year. Yeah, our sweet spot is 250 to 300. And if you have any means or capacity to make sure families, parents, children are coming to this event, and to let them know again, it is more than just a back to school fair, that there will be individuals there doing women's health exams. We're going to have people doing dental exams. And giving resources and making recommendations. And there's a plethora of things. There's going to be a group there doing double Dutch. So we're going to have fun that day. So when activities like this hit your inbox from me or my team, it's usually from my outreach person, Carlos. If you see something from either of us or any of us, just to action that. And I think the other thing that would be most helpful, Bishop, is in those instances where we have a gap and a service is not addressed, we don't have a provider lined up. For example, I don't know the answer to this, so I'm putting my team on the spot and I'm putting a star by this question. I believe we have not identified vaccinators yet. We try again, and it's a different day and age, but these are back to school events. A lot of kids need back to school vaccinations. And then the other category is back to sports physicals. In years past, the health district was able to help with that. Immunize Nevada was able to help with that. So, we're dealing with different decks on the chair on the different circumstances, I should say. So anything you can do when we do reach out with those type of questions would be very much appreciated.
Thank you so much, Bishop Bonnie Radden, for your thoughts there. I wanted to quickly highlight before any additional questions as well. Alex, I believe, shared that they do have a volunteer form that could potentially be shared with the group. So I did want to highlight that. Alex, I hate to put you on the spot here, but is that something that might be shared after this meeting?
Alex Neal for the record. Yes, we have a flyer, which you guys may remember seeing in the past, as well as the actual form, and that can be shared via email. And I believe it is something that we are also going to be working to make sure it's on the web page as well.
Awesome. Thank you so much, Alex. So with that said, it sounds like this, Nick Dunkel, once again, for the record, it sounds like this form will be shared. So for the advisory committee members, I think it goes along with both us volunteering or maybe sharing this with folks that we do know that could, as Ms. Dorch mentioned, maybe fill some of these spaces that are needed. I think that would be a great means of doing so. While I was speaking, I did see a couple hands go up. Bishop Bonnie Radden, your hand is up, but I'm not sure if that's from the last question. Did you have another question?
Yes, I did have one more question, and I'm not quite sure. Do y'all see me or no?
No.
We
I
do
don't know
not.
what happened. The camera's off. It's on, but it's off. I don't know what happened. I'll try to see to fix that. Bishop Bonnie Radden, for the record again, just one quick question, because I've been working a lot with the housing insecure down in Fort Master and that area. Lots of youth, lots and lots of kids. I'm wondering how far this, I'm not directionally challenged, how far this might be if we could, maybe get some families who obviously, would have challenges around, getting a backpack and the supplies that they need for their children. Do you happen to have any idea of how far this might be away and from Fountain of Hope, AME? And then I'll try to work on how we can get those individuals there. That's a great need, I can tell you right now.
Bishop, wonderful thought process. Short answer is please, let's make this happen. As I mentioned, the resources are so plentiful and they cross multiple spectrums that a family should come. It's not just the kiddos are going to get their backpacks, are going to get their pens and all that great stuff, but there's so many other things that a whole family, it's the whole person, the whole family that benefits. Now we see your feet, Bishop, so you might want to turn your camera a little bit. There you go. But as far as logistics and proximity, for the easiest way to make you know where Cannon is, it's a few blocks away from, it's off of Sunset, a couple of blocks, and very close in proximity to the airport. So that's usually, instead of giving you addresses and things in crossroads, that everybody knows where the airport is. So it's right off of Sunset, a couple of blocks away. So we unfortunately cannot coordinate logistics for transportation, but you have enough time, right? And this could be, what works really well with these kind of activities. We've done it for some of our outreach for clinical trial diversification activities. We go to some of our assisted living facilities and those congregate homes, and people can bus people there. That's how you get people. If you can make a transportation route, or if there's some way you have the ability to accommodate transportation, and you let us know in advance so we can make sure we are ready for the numbers, I think that would be a wonderful thing, because you're right, that's a population that would check a lot of boxes and meet a lot of needs.
If I could just make one comment again, Bishop Bonnie Radden, for the record, what I will do is try to work with some individuals that we've been working with there to see how we might be able to rent a bus or something that we can transport these individuals to Fountain of Hope. And I can just tell you, I mean, I can't even begin to tell you the youth that are homeless at this moment. It's unbelievable. With families, it's families.
Absolutely. And just one correction, Fountain Hope is one of the organizers. It's going to be held at Cannon Middle School.
Oh, Cannon Middle School. Okay.
If
great.
someone could put the address in the chat box for me, just so Bishop has it. But it's Cannon Middle School that's hosting it. We are working in concert with Fountain of Hope Church to organize.
Thank you.
You are so welcome.
Dr. Whitlock Lax, for the record. The address is actually on the flyer for Helen Gannon, 850 Euclid Street.
Thank you very much. I'm looking at like 12 screens, so forgive me.
Not worries, not worries. Just to let you know.
I appreciate you. Thank you.
And
Mr.
one other comment.
Yes.
These are great for Southern Nevada. I'm wondering, we do an outreach at Bethel AME to those who are disenfranchised, food insecure, and those experiencing homelessness. We try to do that every other month. We did partner with Molina Healthcare on last weekend, where healthcare workers came together and we, as a church, provided food. I'm wondering if there's some connection, some support from NOMHE that would partner with us for our July event here in Northern Nevada.
You know, we have been trying to work with you and your outreach for some time now, and logistically, we have just like been ships passing in the night. Let's talk offline. Let's talk offline. Not to be secretive by any means, but just to go through some of the challenges and see if there's solutions to the challenges. Because again, we are a statewide agency. It's just very difficult given some of the limited bandwidth to make all of our needs statewide or all of our resources and activities statewide. But let's for sure talk offline. If you're open to it, I'm open to it.
I'm absolutely open to it. And by the way, Catholic Charities was at this last event, and they were doing vaccines. So I don't know if that was is an avenue that you might check out. I don't know how they were doing the vaccines, but they certainly were providing vaccines.
I believe, Carlos, you're on this call. Please, if you could take note of that, if we still have that as a need. Thank you for that suggestion. We'll track that down.
Absolutely.
Mr. Chair, I think for the sake of time, I'm going to move to the next part of our agenda.
Just one item real quick, Ms. Storch.
Yes.
I just wanted to quickly, before we move on, Reverend Dr. Deborah Whitlock Lax, I know that you mentioned an event that you do every other month, and wanting to get kind of work going here in the north. I'm here in the north as well, and I know that you and I need to get together. I just wanted to let you know that you also have my support as well, whether it's hands-on volunteering or maybe logistic support. Ms. Dorch, I know that you and your staff are kind of pressed for time often. So if there's some way that I can maybe work with you and Reverend Dr. Deborah Whitlock Lax on maybe working to get some things together or providing logistic support even, I just wanted to offer that I would be more than happy to do so.
The record. Thank you so much, Nicholas. I welcome. We just have to get on each other's calendar.
Yes, ma'am.
I love that. That is an amazing, organic, collaborative opportunity. So thank you very much for being so amenable. just to keep us moving, under NOMHE accomplishments, it's not just our outreach per se, right? Just for the sake of outreach, but we are doing some structural improvements. And to that effect, our webpage, if you haven't visited it in a while, please do so. It is under construction and revamping. You heard input from our public information officer. We work closely with him, but we are trying to make it a place that evolves into a destination point, and that content will be added to that effect. And so our YouTube playlist, you can see that on the left side. That's kind of a screenshot to see what's there. Much more contents to come, but even right now, you still can, as my nephew would say, smash the like and subscribe buttons. So we would really appreciate you giving us shout outs there. Um, and then in the right column or margin of our web page, we have a new component which basically houses all of our event flyers. And it basically has information from our current events and our past events. And when you look at the past events, it really does tell a story. I joined the agency in 2018. As many of you know, I was in Office of One for about 2 years there. And so there was not a lot of activity that as you would see now. And but when you look at it, it's very heartening. I like to look back and see that we've got events that go back to 2020. And those are just the events that we were leads on. So keep that in mind when you do visit and just look at the historical path that we have followed. Those are activities that NOMHE led, not just where we're partnering with and amplifying the work of others, but so it's nice that we've championed this work over time. And over the next quarter, there's going to be additional changes coming, and we look forward to walking you through those changes during the August meeting. I'm literally going to do Alex, if I can get it done, and Alex can help me figure out all the bells and whistles. I'm going to do a live demo of some of the features of our web page, and I think you'll find that engaging. Also on the right side, you can see that harkening back to the work under clinical trial activities, we've been very demonstratively working with the Department or Division of Public and Behavioral Health. There is a assembly bill that dates back to 2017 that provisions the state be more mindful and intentional about diversifying this topic, and it names that we should be supporting the division, and that's what we've been doing. So we have helped them update their webpage. Their webpage is, if you looked at it prior and look at it now, you can definitely see the improvements. And there are categories that you can now search under research opportunities in Nevada, national research opportunities, what it means to have a diverse participation in trial work. We can also look up other researches. Our researchers can actually use it resources as well. So I think it's going to be a benefit to many individuals. And I want to give a shout out to our Vice Chair, Dr. Hickson. We have a product that is in constant review. We're trying to just get it right. And it's kind of like a user-friendly document. We're going to just say document right now until we finalize it, that talks about clinical trials that can be shared. And Dr. Hickson, thank you for working with us on that. And again, that's what we have you as advisors for. We lean on your expertise in these examples. And lastly, the Division of Public and Behavioral Health is required to do an annual report. And not to toot our own horn, but much of the report is predicated on the work of our office. So it is a very symbiotic relationship we have with the division, and we're all benefiting. But if there are there any other questions about this last point of updates from me before I turn it over to my colleague?
Reverend Dr. Deborah Whitlock-Lax, applaud for all that you do. And yes, toot your own horn, because if you don't speak, who will speak? And so we all should be speaking, but you are, on the ground floor. And so we applaud you for everything that you do. And yes, toot your horn and toot it loud.
Thank you. There's a phrase that comes to mind, and there's a fine balancing act with that is you how to toot your horn without blowing it. So think about that. But moving on, I'm very excited about this next presentation from program NOMHE's program officer, Evelyn Donis de Miranda. We are pivoting, as I mentioned, in a couple of ways. We're going to be working with the Department of Public Safety, and you'll hear about that work later in the year. But right now, Evelyn is really starting to take up space within the immunization dialogue. And she is working with our sister division, Division of Public and Behavioral Health. She's collaborating actually with their state immunization program, and they're analyzing data among Nevada's population that's 50 and older to identify factors impacting vaccine distribution trends when it comes to the pneumococcal vaccine. And I just want to say, as a personal statement, I literally got my pneumococcal vaccine because of this project. Go ahead, Evelyn.
Well, hello everyone. Can you hear me okay? Yes. Okay, perfect. So my name is Evelyn Donis, and I'm a program officer, one with the Nevada Office of Minority Health and Equity. And basically, I'll be presenting on a project that I've been working on that focuses on improving immunization access in Nevada, specifically access to the pneumonia vaccine for those of ages 50 and older. So this project addresses disparities in vaccine availability, awareness, and uptake with the ultimate goal of supporting better public health outcomes across the state. So all of this information is preliminary because, we still have to send it out for review to our public resource officers and other individuals who supported this project. So next slide, please. So this project was made possible thanks to the collaboration between NOMHE and, the Nevada State Immunization Program with the Department of Health and Human Services, the Division of Public and Behavioral Health. And the purpose of this project was to basically develop a comprehensive immunization access analysis, which, ultimately is going to serve as the foundation for a pulse report that we are currently working on. The report is intended to provide actionable insight into where gaps exist and how access to vaccines, specifically, the pneumonia vaccine, can be improved across the state. So as part of this project, several key actions were taken to build a comprehensive understanding of immunization access in Nevada, again, especially about the pneumonia vaccine. And basically, as part of the project, I began by analyzing vaccination data. And this was thanks to the collaboration that we were able to do with the Office of Analytics. They were able to give us all the data. And like I said earlier, we were focusing on adults age 50 and older. And the data was collected and analyzed by counties here in the state of Nevada. And I think that this allowed me to visualize, geographic differences and identify which counties, have higher or lower pneumonia vaccine percentages among older adults. And then on top of, looking at the data, I was also looking at Nevada Social Vulnerability Index to give a little bit more context to the vaccination data. And this helped me, understand a little bit about each county's access to resources and identify, communities that maybe face additional barriers such as limited transportation, lower health literacy, and other, issues such as And on top of that, we also did we gathered some qualitative data, conducted 20 interviews with individuals who were age 50 and older, across the state. These interviews were designed to gain deeper insight into people's perception of vaccinations, especially about the pneumonia vaccine. But I also the purpose of these interviews also aim to identify key barriers and facilitators that influence vaccine uptake, such as trust in healthcare providers, misinformation, cost, concerns, or, convenience of access. And, after, reviewing all these 3 data points, I guess, I developed a series of recommendations, and I will be, talking about all of that. So next, I guess. So before I dive into the results, I guess I would like to take a little bit of time to just talk about pneumococcal disease. Next slide. Maybe you're wondering why I did focus on the pneumonia vaccine, and I guess I want to start by talking about the pneumococcal disease, which is basically caused by a bacteria, called Streptococcus pneumonia. And this bacteria is kind of dangerous because it can cause several, diseases like infections in the blood, in the brain and lungs. So I guess at one point, these infections can become invasive pneumococcal disease, and approximately 10% of people who actually get this stage of the disease die, and the death rates are higher among the elderly community and things like that. So in 2022, there were approximately 20,000 cases of invasive pneumococcal disease in the United States, and these numbers were actually higher than 2020 and in 2021. So on the screen, I'm showing a table that provides the numbers of invasive pneumococcal disease in Nevada specifically. As you can see, the higher rates or numbers are among those who are 50 and older. And actually, the CDC changed the recommendation of the pneumococcal vaccine last year. So, and then just focusing on 2024, it seems that the numbers were higher compared to 2023. So that's just a visual, of pneumococcal invasive disease in Nevada. Okay, next screen. So the CDC provides guidance on recommended pneumococcal vaccines, which, are the ones that help prevent this disease. So the recommendations state that adults who are age 50 and older and have never received a pneumococcal vaccine before, pneumonia vaccine, should receive at least 1 dose. So there are different types of vaccines. So on the screen, I'm just showing like a picture of the vaccine schedule or the tab, where it says none. That means that if you have not received any pneumonia vaccines, you should at least get one, and you could get the one that is called PCV20 or PCV21. And then if you get the PCV15, a year later, you should get a booster, which is called the PSV23. And like I said earlier, these recommendations recently changed. I believe they changed back in October of last year. And before that, the recommendation basically stated that people who were 65 and older could get the vaccine. Okay, so next slides. So let's dig into the results. So like I say, the Office of Analytics within the Department of Health and Human Services was able to provide data on vaccination numbers for the pneumonia vaccine. So next slide. So I know there's a lot going on here, but I'll try to, give a good summary of what I'm showing here. So a key part of this project was analyzing pneumonia vaccination numbers by county across Nevada. So in 2024, this is data from 2024, and on your left-hand side, that's the county. And then the rest, you can see how many people were vaccinated, the number of people who live in that county who are 50 years and older, and then the percentage, of how many of those got vaccinated. And I actually have 2 separate groups. So I did a analysis on the 50 to 64-year-old individuals, and then the 65-plus-year-old individuals. So in 2024, there was a significant difference in vaccination numbers between the adults who were aged in 64 compared to those who were 65 and older. So approximately 38,000 individuals got, vaccinated who were between the 50 and 60 year old group, in contrast with 275,000 individuals from the 65 and older age group. So, and this difference kind of makes sense because, I mean, the recommendation recently changed, so maybe that's why we're not seeing a lot of this 50 to 64-year-old individuals getting vaccinated. So it's likely that the younger adults were not being routinely vaccinated before the recommendation update. So the purpose of this analysis was to identify which counties had higher or lower vaccination rates, particularly among these populations, so we can better understand where to focus the outreach and resources. So on the screen, you'll see that I have highlighted in yellow, and those are the counties with the lowest vaccination rates. And you probably can see that some of the counties are Eureka, Lincoln, Esmeralda, Lander, White Pine, Clark County. These counties have the lowest percentage of vaccinated individuals in the 50 to 64 age group. And it's very similar for the 65 plus individuals. The only difference is that Elko County actually had lower rates in the 65 plus group compared to the other age group. So while many of these counties, such as Esmeralda and Eureka, have relatively small individuals living there, the vaccination percentages still reflect significant gaps when adjusted for population size within each group. So on a more positive note, some counties consistently show higher vaccination rates in both groups, such as Washoe, Churchill, and Mineral. So, I think that these findings were crucial in this report because that's going to help us understand where we have to focus more. Okay, next slide. I also did a comparison among race and ethnic groups. So those with lowest vaccination rates for the 50 to 64-year-old group are non-Hispanic, Asian, Pacific Islander, and for the 65 age group were non-Hispanic, American Indian, or Alaska Native. On a positive note, among the individuals aged in 50 to 64, non-Hispanic and Black individuals have the highest vaccination rates at 6.5%. And then among the 60, oh, okay. Among the age of 65 and older, numbers were higher with non-Hispanic white individuals at 39.4%, followed by Hispanics at 36.7%. Okay, next slide. Like I mentioned earlier, I also look at Nevada Social Vulnerability Index because I believe that this was going to give us a little bit of more context on each county's, access to resources. So now I'm going to talk a little bit about that. And next slide. Okay. And so the data I'm referencing is actually from 2022. I believe that's the latest data I was able to find. And I think it provides important insight into how counties might respond during public health emergencies. So in this case, it tells us how equipped they are to support widespread vaccination efforts as well. I got this data from the CDC, and the social vulnerability index is based on a range of factors that influence a community's ability to respond and recover from adverse events. Some of these factors are like socioeconomic status, including income, employment, education, household composition, race and ethnicity, housing, and transportation access. So on the screen, you'll see a map of Nevada where each county is color-coded based on its social vulnerability. So counties that are highlighted in yellow represent those with low level of social vulnerability. So this means that in the event of a public health crisis, these counties are likely to have the resources and infrastructure to respond effectively, right? So low vulnerability. So some example like Douglas, Story, Eureka, and White Pine County are some of those with low vulnerability. On the other hand, counties with high vulnerability include Washoe, Nye, Esmeralda, and Clark County. So these areas may face more significant challenges in terms of healthcare access, transportation, socioeconomic support, and other key resources during emergencies or vaccine rollout. So this information helps us identify communities that may require additional support during public health efforts like vaccine distribution and other stuff. So there is a lot of more detail behind this, indices and how they interact with vaccine rates and access and all of that, which will be all outlined more fully in the report that I am creating. So I didn't want to include a lot of information in the presentation just because of time, but there will be a better explanation on the report. Okay, so next slide. So an important part of this project was also understanding the perception and experiences of individuals age 50 and older regarding vaccinations, especially the pneumonia vaccine, because that was the focus of the project. To capture these insights, I decided to conduct individual interviews which provided rich, detailed feedback beyond the data that I had already collected. So to identify potential interview participants, I first created an interest survey designed to collect demographic information, vaccination status data, and most importantly, to collect contact information so I could reach out to the individuals and conduct interviews. So the survey was developed using RedCap, which is a secure web-based platform ideal for research data collection that we have here at DPVH. So to reach a broad and diverse group, I reached out to multiple community serving organizations, including DHHS, asking them to share the survey link with their networks, also asking them if they, knew of somebody who could participate in interviews. So this was very important because I feel like I was able to get, a variety of participants to participate in the interview. So next slide, please. So like I say, first I did an interest survey to be able to gather a number of individuals to be contacted for the interview. So I'm not going to go into a lot of the details about the demographics of those individuals who completed the interest survey, but this is something that you will be able to see in the final report. Want to briefly discuss on the participants' pneumonia vaccine status. So a total of 164 individuals actually intended to complete the interest survey, but only 149 answered all the questions. So out of those 149 individuals, 93 said that they have not received the pneumonia vaccine and 48 said yes. Those who indicated yes to have received it, the majority said that they received less than a year ago. And those who have said that they have not received it, we asked them if they had been advised by a healthcare professional to get the pneumonia vaccine. The majority said that they have not been advised to receive it. Next slide, please. I also asked them if they will be willing, for those who said no, that they have not received the vaccine. I also asked them if they will be willing to get the pneumonia vaccine. 54 said yes, and the rest said no or maybe. And those who said no or maybe were asked why they would not be willing to get the vaccine, and the majority said that they did not have enough information how well it worked. And the second response was because they were concerned about the side effects. Okay, next questions. Oh, sorry, slide. So like I say, those were just some of the answers that people gave in the interest survey. So from those individuals who completed the interest survey, I contacted a total of 38 individuals to participate in the interviews. Selection of participants was based on whoever completed the survey first, trying to get a diverse range of participants from different counties and things like that. So from the 38 that were contacted, only 20 actually completed the interview. And the interviews were guided by a semi-structured interview guide developed using the CDC socio-ecological model as a framework. This model was chosen to capture influences at multiple levels, which can be important when reviewing vaccination rates in Nevada. So interviews were conducted virtually or telephonically based on participants' choices. Microsoft Teams was used to auto-generate transcripts, which helped me in the analysis of the data. Next slide. So I do want to show you like who actually participated in the interviews. So here's a breakdown of who participated. Like I say, the purpose of the interviews was to gather insight about what people think about vaccines, especially about the pneumonia vaccine. Furthermore, I asked questions that could lead us to identify potential barriers to vaccinations, but also facilitators that help people get vaccinated. And lastly, I collected some data that I transformed into recommendations to increase pneumonia vaccine access, but I feel like ultimately this data could help us for other vaccines and things like that. So on the screen, you can see how many people were interviewed from each age group. The majority were from the 50 to 64-year-old age group. We have some variety in race and ethnicity. This was a select all that applied type of question. So, some people chose more than one race. The majority of individuals that were interviewed were women. Everyone was employed. The majority had private health insurance. And I was able to interview individuals from different educational levels. So you can see um, some has associate degree, bachelor's, high school, some college. And lastly, I believe that I was able to interview participants from different areas in Nevada. So you can see the participants came from different counties, such as Carson City, Clark County, Douglas, Humboldt, Lincoln, Lyon, Washoe, and White Pine. Okay, next slide, please. And so an inductive coding analysis approach was used to find key patterns in the data that I collected from the interviews. So this approach basically focused on allowing the themes to emerge directly from participant responses rather than being predetermined by me or by someone else. So, final information came together and we began to identify broader categories, which led to the development of 5 themes, which is basically what I've been mentioning. Theme 1 is about perceptions over vaccine uptake, which focus on attitudes, beliefs of participants toward vaccinations. Theme 2 was about knowledge on the pneumonia vaccine. Here I was able to get a sense of how much participants knew about it. Theme 3 focused on barriers to vaccine uptake, taking all of those things that the participants said that could be potentially a barrier to get vaccinated. Especially in their communities. Team 4 was, facilitators. So now this is focusing more on those things that can help people get vaccinated. And lastly, Team 5 is the recommendations that I developed. Next slide, please. Okay, so now let's talk about what I found through the interviews. So from the interviews, most participants expressed positive attitudes toward vaccines. Overall, but their views fell into 2 different groups, pro-vaccine and willing or already vaccinated. So these participants were generally supportive of vaccines, including the pneumonia vaccine. They had already, received it, or, now they were thinking about it and willing to get it. Such as Tina mentioned earlier, that after, doing this project, she decided to, get the vaccine. And then we have the other group of people who were supportive about vaccinations, but they were personally hesitant. So meaning that they wouldn't get vaccinated. And they had different reasons, they thought that they were healthy. They didn't think that it was an urgent need to get vaccinated or believed, that they didn't need any more vaccine at this time. So most participants view official vaccination recommendations positively and generally trusted public health guidelines. Family and peer groups were mostly supportive of vaccinations, but the attitudes towards vaccines did not significantly change after COVID-19, indicating a stable perception of vaccinations. And I just want to say that these results are about the people that I interview. So opinions on vaccine mandates, such as being mandatory, were mixed. Some thought that it was needed because of public safety. Others thought that individual choices should be respected and nothing should be, forced. When discussing the pneumonia vaccine specifically, most participants revealed that they had limited or no knowledge about it. And I think that this vaccine actually has been out for a long time. So I think it's kind of surprising that people still don't have a lot of information about it. Maybe because of the age requirement. So also, many individuals express a strong interest in learning more about key topics on the pneumonia vaccine, specifically like potential side effects, a risk associated with not getting vaccinated, recommended frequency and vaccination schedule. Some people didn't know that this was a one-time type of thing, unless you get one of the ones where you needed a booster. They also want to know like what is in the vaccine, like the ingredients and all of that. And I feel like especially this key topics could help us, for the next project that we're gonna do. Okay, like this is maybe some of the things that people actually want to know when it comes to vaccines, like potential side effects, risk of not getting vaccinated, and recommended and the schedule of vaccinations. Okay, next slide. So during the interview, several key barriers to pneumonia vaccine uptake emerged, and I think this could be also for any type of vaccines. And I think that the main one was limited vaccine availability, especially in rural areas and at local pharmacies. There's also lack of healthcare facilities nearby and transportation challenges, that can definitely affect vaccination uptake, confusion or uncertainty about eligibility despite insurance coverage. I don't know if you heard me earlier, but I was just saying that the majority of the people who did the interviews had health insurance, or all of them. And I was still hearing that a lot of them have, cost issues because either the pharmacies that are around them don't take their health insurance. So even if you have health insurance, cost can be a barrier, or out-of-pocket cost. So misinformation, about vaccine. I mean, in general, lack of trust in pharmaceutical companies and government agencies is also came up as a barrier. Fear or concerns about side effects and vaccine efficacy was also mentioned. And limited provided outreach and public health messaging, specifically about the pneumonia vaccine, also came up. Like a lot of people have not heard about it. Their providers are not talking about it. Also, many participants were unaware of non-pharmacy vaccination options available in the rural communities. So, addressing these barriers require probably more education, expanded vaccination access points, and building trust. And so I know that I just talk about the barriers, but also I want to talk about like several key factors that encourage participants to get vaccinated within communities. So one of the things that they mentioned a lot was, that they often see signage in pharmacies and reminders through TV, radio, and social media that help, raise awareness and prompt action to get vaccinated. Strong recommendations from healthcare providers were a major influence on participants' decisions to get vaccinated. So some of them will say things like, well, if my doctor recommended, I'm willing to do it, and things like that. So support and encouragement from family members, especially those with health conditions, motivated individuals to get vaccinated. So a lot of them will be like, well, I got vaccinated because my family has some health condition. I don't want to get them sick, and, those kind of things. A desire to stay healthy during the flu season or outbreaks, encourage vaccine uptake as well. And a major one was actually work or their jobs, particularly if they work in the healthcare setting, or, they're working with people. That was also a big motivator for people to get vaccinated. And also, people mentioned that if they knew someone who had pneumonia before, or, they themselves had experienced, the illness, that increased the perceived risk and vaccine acceptance. So these facilitators, highlight opportunities to leverage trusted messenger, social support, and timely reminders to improve vaccination rates. Oh my God. Okay, we're almost done. And lastly, these are some of the recommendations. I do want to say that these recommendations may seem a little bit, broad right now, but in the main report, you're gonna be able to see like the whole set of recommendations. So basically, I decided to use the socio-ecological model again. So you're gonna see that I developed the recommendations in different levels. So individual level, those are, the recommendations for the individuals, and basically, um, some of them are that individuals can talk openly with healthcare providers about the pneumonia vaccine, promote the use of trusted sources of health information, foster supportive conversation that address concerns and benefits of vaccination, empower individuals, support family and peers in accessing vaccination services. Then I have the relationship level. These are recommendations that focus on interpersonal relationships, such as those with family and friends. And I think that one of the main takeaways of the main recommendations of this section is to leverage family and peer influence. So in vaccine outreach and education efforts, so include family members in those efforts. Also encourage caregivers in close contacts to initiate vaccination discussion with loved ones, especially those at higher risk. One of the perfect examples I can think for the relationship level is like I'm basically an advocate for my mom, so I think for me it's very important to like when if I go with her to her appointments, like hey, discuss with the provider like what are like some of the vaccinations that she may need. Then we have those recommendations at the community level. Those are the ones that focus on improving environmental and systems within communities to support vaccine uptake. And basically, the recommendations are about expand trust non-pharmacy vaccination sites to improve accessibility, especially in rural areas. Use preferred communication channels. Like I will hear a lot of people saying that they don't watch TV anymore, or they're using like the streaming devices, so they're not looking at commercials and stuff like that. So finding, the right way to engage the community, I think is important, especially for this community. We need to focus on like providing printing materials, especially if they're coming from the healthcare providers. I think they trust that. Um, we want to integrate vaccine discussions into routine healthcare visits. Also, like make sure that school-based outreach programs are also focusing on, reaching out to the elderly community, especially the K through 12. And then I have some recommendations on the social level. These are recommendations that address broader policy, economic, and systemic structures that influence health behaviors, like vaccinations. And these recommendations are mainly like develop education campaigns that focus on increasing understanding of the pneumonia and its risk before promoting the vaccine. So don't focus so much on here's the solution, but like what is the issue? Like what can be the consequences if I get pneumonia, and things like that. Also try to focus on designing community campaigns featuring real stories and testimonials to build trust and relationships. So I think that a lot of times, people don't trust pharmaceuticals, or they see that the vaccine may come from, pharmaceutical company, they may not trust it. Also, expand vaccination access points, so beyond the traditional settings to include community partners. One of the things that was mentioned a lot was mobile clinics. Like that was a big one. And then also one of my recommendations includes that Nevada joins nationwide efforts to improve disease tracking and surveillance for better public health response. And then there's more recommendations that, like I say, all of those will be in the final report. So there'll be more details in there. I just wanted to provide a very quick overview of the project and what is coming. But that's it. Thank you. Sorry, that took a long time. Okay, questions?
Thank you very, very
Yeah.
much, Evelyn. We're going to open this up for questions, and I just want to kick them off by framing the work that Evelyn has done. She's going to be pivoting in the next few weeks into another project on H5N1, the bird flu, which is also very timely. So a lot of the work and recommendations that she's finding here will have relevancy as she goes forward. So are there any comments or questions for Ms. Evelyn? Dr. Hickson?
First of all, thank you, Evelyn. I know this project is very, very timely and very, very important. And being someone that actually works in vaccine research, it is important that we get this out there. There are a couple of things, though, that I did have question, particularly regarding where the numbers came from in regards to the percentages of vaccinations, in large part because not every entity that provides vaccinations reports that the vaccination has been given, whereas in more healthcare entities, they are required to register that with the state's immunization kind of database. So I'm just curious as to that number. And then the second question, just for the sake of time so that we can get them both out there, is whether or not there are recommendations for increased provider education on the signs and symptoms of pneumonia, because many times I see patients that have actually had pneumonia but were told they had the flu. And because those situations are so, the symptoms are so similar, albeit there are some variations and some differences there, 9 times out of 10, we are dealing with people in this population who are being misdiagnosed. And so when you talked about that recommendation about having that personal experience with the disease, the question becomes, did that individual even know that they had it? And so I think that's an important thing to raise, because a lot of times some people don't get symptoms, but they have it and it's only detected through testing. So I'm just curious to know if that's a potential recommendation.
Yes. So for your first question, like where the data comes from, so I work with the Office of Analytics to get the count, the numbers, and then they also gave me the population numbers that came from the demographer, like here in the state of Nevada. But I believe that all the numbers were collected from the WebIC system that we have. So yeah, if the providers are not participating in that program, we wouldn't have that information. So that is definitely a great thing to note. And then for your second questions about the recommendations, I do have a recommendation that is part of the societal level, which is basically saying that providers need some type of training, that helps them. I think I focus more on like how to approach the topic about vaccinations, but I think that you bring a really good point that the education should expand to differentiate the symptoms between flu and pneumonia. So I think I'm gonna definitely add that. So thank you.
For sure.
I hope I answered your questions.
You did. And the WebIZ was really the most important one, because oftentimes what I've been finding in public health data is the fact that we keep pulling from CDC's data, but we know that CDC's data can be very limiting and sometimes very inaccurate. And my concern, for example, with my agency is that because we are classified as a research institute, we are not required to register our vaccinations that we provide into WebIZ, because we are not granted that access. So every year you're talking about hundreds of thousands of patients that are receiving a vaccination that's not in that database because we don't get granted access to it. So that's the only thing that I would say. And when you think about a county like Clark County, we have tons of research centers that are producing and giving vaccinations, and these are real vaccinations. They're not placebos. They're not anything like that. They're real vaccinations, but we are not legally required nor granted the opportunity to register those within the system. We can pull, but we cannot register. So the question becomes, do we have that vaccination, that real data that really supports the fact that vaccinations are not happening?
And so I feel like this is actually a good thing to know. And feel like I might add this as one of the recommendations, like make sure that they're including like research centers, into the system, because yeah, we're missing out on a lot. I mean, especially if you're not able to enter all the information in there, because yeah, that's where the statewide, system that we have. So thank you for sharing that, Dr. Hickson.
And it looks like I see Nancy Bowen. I saw Angie Wilson, but her hand went down. So go ahead with Nancy, and oh, it's back up. So you've got Nancy and then Angie, Evelyn.
This is Nancy Bowen. Thank you so much for that. It was a really great presentation and detailed report. I have two questions as well. One is how Washoe County had such a high percentage of vaccinations compared to the other major urban area of Clark County. Is there anything that you're going to be showing in your report of best practices from Washoe County that the other counties can take and learn from? Because I really think that's that's really, really helpful. And then the other, when you are writing up your recommendations, will you be able to recommend like a policy change that would help with the cost? Because yes, I'm fully insured, but my insurance doesn't cover it as well. But how do we do that for the lower income populations? They're not going to get that. And also, like the research, is there a way to include a recommendation to allow the research facilities, not mandate it, but allow them to submit that information to WebIZ? So those were my two questions. Any best practices that can be shared and any policy recommendations?
Yes. And I do want to say that I feel like that I might not be able to get, best practices from Washoe County just because of the timeline of this project. Basically, I'm supposed to be done by the end of this month, and then I have to pivot into different project. And I feel like I might not have the time to like do a provider type of interviews. I feel like that would have been a great thing to do, like interview some of the providers in Washoe County and I get their feedback, like what are some of your best practices, because you're right, they are one of the ones that have the higher vaccination rate. So unfortunately, I don't think that for this time around we're going to be able to do that, but I do have something in our scope of work for the next project that maybe we can dig deeper a little bit into the best practices of providers in those specific areas. And about the policy change, I do have one recommendation that focuses on the cost of vaccines and, promoting free vaccinations, but I don't think that I have, anything specific to any of the insurance policies. I feel like that will require a little bit of more of investigating for me to pinpoint like specific things that could be changed. At this point, I don't have anything other than a general recommendation that more effort should be focused on providing free vaccination, especially in those counties with low vaccination rates. And then your other question, I think I am going to add one of the recommendations that, research centers be included into the WebIC system. But I feel like I will probably have to talk a little bit more to the people who manage the system to know like why that hasn't been done, if there are any barriers to that. So I will probably have to do a little bit of more digging. I hope I answered your questions.
Thank you, Nancy. And then just Angela Wilson.
Hi, thank you, Evelyn. A great presentation. Thank you so much. And I just wanted to say, I think the answers to my question were just answered. Thank you so much.
All right.
And I believe Dr. Hickson, is that a new hand raise?
It is. I'm so sorry, Evelyn. I just had a question about what the threshold is considered to determine whether or not a county is sufficiently immunized. Because I think one of the other things that I'm curious on is what determines that Clark County is low in immunizations. For example, I'm just throwing that county out there because we know in public health when we're talking about immunizations, we are talking about what is the percentage of our population that is necessary to reach herd immunity? And
Mm-hmm.
therefore, I'm just curious to know what triggered the yellow highlights in some of those counties compared to other counties. And do we actually have a legitimate threshold that we need to reach?
I am not sure if we have a threshold, but that's something that I can investigate with the NSIP people, the immunization program. So I'm gonna ask them about that. And when I highlighted, the counties with the lowest vaccination rate, those were basically based on the percentage, like the top 5 with the lowest vaccination rates.
Thank you.
Thank you so much, Evelyn. And Mr. Chair, with your permission, I'm going to keep us moving along the agenda. I'd like to ask if our interpreters, if we run about 15 minutes over, are you able to stay?
Apologies, had a hard time figuring out how to unmute. We both have other assignments after
Okay.
this one.
Understood. Understood. We just thought we'd ask. We'll try and be as brief as we can.
Thank you.
Thank you. And board members, again, just appreciate Evelyn's work there. And as I said, I think the lessons that she's learning and some of the topical components of her work will translate to H5N1 work she'll be doing next. So just to wrap up very quickly, NOMHE activities. So what's next for NOMHE? You've heard us talk about our 20th anniversary activities. We are still moving along in a very modest way. We're not an organization that's able to do grandiose things, but in meaningful ways, we are recognizing the passage of this milestone. Just those 4 bullets, all are being done with regard to our theme, which is getting to know me. And so just a play on words there, making sure we hear often over and over that folks are still not aware that the office exists, and we understand why that is. Small office, small footprint sometimes, but we're working to make sure where we should be visible, we are. So to that effect, one of the things we're going to start doing is making sure that all of these recordings from our quarterly meetings are now placed on our website. So even though you might see abbreviated minutes, or you may not be able to stay or participate as a member of the community, you can, at your leisure and asynchronously, so to speak, listen to meetings. The testimonials and recognitions activity is one that we definitely are going to still lean into. We have been working with our PIO on what that looks like. Invitations for these testimonials are forthcoming, and individuals who are recognized as champions in, say, health or academia and governmental sectors, they're going to be invited to record their thoughts and their recollections and their unique perspectives and personal relationships with NOMHE over the years. And then these recordings will be found on our website. We think it's going to be a really powerful display. Continued outreach activities statewide, that does not go away. That's our staple. Hoping to get to the north more. Bishop, or not Bishop, I'm sorry, Pastor Wade Whitlock Lax, hope to get up to the north more often. And then the last thing I'll end with is the emphasis on our continued collaborations with our state agencies and community partners. We know we can't be everywhere doing everything. I tell my team that we have to avoid the bright, shiny object syndrome. Everything sounds great and is important, but we have to really be intentional about where we put our efforts and our energies. So during our annual partners breakfast, which will be in the north, which will be on August 12th, we're going to be talking to all of those individual collaborative partners about a call to action. And this call to action is going to be basically fostering stronger cross-sectoral collaboratives that purposefully empower community level resilience. Like, what does that look like? How do we make that work? That is a legacy that the Office of Minority Health and Equity wants to make sure we start grooming and developing going forward. So, Mr. Chair, that wraps up section and agenda item number 6. I think that we took took questions pretty thoroughly throughout agenda item number 6. So with your permission, I'd like to just start with our final informational item.
Please proceed.
Very good. Thank you, Mr. Chair. So you could go to the next slide there, please. So we are talking about what just concluded. Our 83rd legislative session ended at midnight on Monday, June 2nd. And we ask that you understand that it's not possible to present final outcomes of this session, given that the process still has other milestones. The governor, for example, still has bills sitting on his desk. And given that the session is just rested, he's got 10 days, starting from June 10th, with the exception of Sundays, to action those bills. And actioning could be a signature, a veto, or to not move. So we still have time before we can truly say that the what we know to be final law is in place. But we felt it was more important to bring this up to our advisory committee now as opposed to August. We have a full agenda in August, and we wanted to make sure we were responsive to you as we've always promised. So also, just to kind of frame things and to level set, this was a very interesting legislative session. It initially produced several bill draft resolutions where NOMHE was either named and or directly involved. But as of sine die, or June 2nd, there are now no bills that reflect our involvement, not directly. But having said that, we still maintain a very vested interest, and it's a mission-driven interest in many of the bills that we're going to share with you as we go into the next few slides, and that we also are going to be very busy continuing to lift and implement bills from past sessions. So that doesn't go away. Just keep that in mind. So before we share the results over the next few slides, Alex, you can go to the next one. We're going to take a few moments and just anchor ourselves into some educational information. And I think it's never too soon to prepare for the next session. And in all likelihood, there's going to be a special session. So this information, this primer might be useful for some and helpful for others. So what you have on the screen right now is just simple glossary. And for the most part, the items on the slide, it could be many more items. We just wanted to give you verbiage that we're going to be using throughout today's presentation. You might hear me say today. And also it might be verbiage that you would encounter if you on your own decide to go into NELIS or the state's online legislative tracker. And NELIS stands for Nevada Electronic Legislative Information Systems. So if you decide to go back into NELIS on your own, you might see some of this verbiage. So for example, you see the last one there, sine die. You have probably heard that used more times than at this point in a biannual period than you ever will outside of legislative session. You've probably never even said sine die outside of legislative session. But the next slide is also just for level setting and just to anchor you. Those are acronyms that you're going to see and or hear a lot. Most of those are familiar to everyone that's on this call. So let's go into our next slide. All right, so let's get into the educational piece, can we? So you've got a slide here and hopefully you can make it out, but I'm going to walk you through it and it'll make it a little bit less it won't be as clear as mud when I'm done, literally and figuratively. But if you take a look at this slide, this is basically Nevada state government, right, in a visual way. And we consist of multiple officers and agencies and boards and other bodies. And it's broken up into those three categories that you see, the judicial branch, the executive branch, and the legislative branch. And they present in this organizational chart just a way to make sense of it all. And so let's start with this, understanding that for our purposes, we really do focus on the legislative branch during this period of time. But to your far left, you see the judicial branch, and this is our court systems, right? State court systems ranging from our Supreme Court to our municipal court to judicial commissions, okay? And then there in the center, you see three major components, and they're broken down by rows, three different rows. And row A is our constitutional offices or entities. And this is ranging from entities like our governor, the lieutenant governor, our attorney general, our secretary of state, our controller, our treasurer. It also talks to and speaks to our academic entities and various commissions. And all of these, keep in mind, are independent of one another. Okay. And in some cases, they hold their own elections, right? And then the second category within this particular section of the organizational chart is our executive agencies. And so the executive agencies are the various departments of state government, including one of the newest, which is the Department of Native American Affairs. We're very proud, and we even announced that last August while we were up north, that it had become a formal department. And then also you see us over there circled in the third row to the right, the Department of Health and Human Services. And keep in mind, all departments report up and through the governor. At the very bottom, you will find kind of special standalone boards. And these are the ones that are involved with things such as the issuance of various licenses. And then lastly, on the right side, you have our legislative branch, right? And much like our U.S. Congress, we've got two-part structure. Our assembly is composed of 42 elected officials. Our Senate is composed of 21 elected officials. And both of these are supported by various committees, and also the very important Legislative Council Bureau, or LCB. And then before we turn from this slide, some would say, Alex, at the very top, the most important component is the voter, right? Of which we all should be. Okay. Hopefully everybody's still with me. And I'm going to do this one pretty quickly as well. This is the basics. This is the big picture. In essence, the who, what, where, and when. And I'm just going to talk about the who, what, where, and when instead of going through all of those. But the who is our elected officials, right? They represent districts and in the legislature, and they're voted to those positions. The what is our legislative session, and that's the period when they meet to pass state laws or Nevada revised statutes, approve budgets that also show up and make their way into our NRS activities, and interim committees, right? Where they meet in Carson City, but we also have video conferencing to make it accessible to all Nevadans. We also are able to join telephonically and through online video capacities. And there's a brand new location in the South. It is in the McCarran Center area near 215 and Warm Springs. Beautiful building. And if you're so inclined, can attend meetings and be a part of it in a very, very personal way. And then just how it's a process that we all can participate in, right? We are voters. We can be special subject matter experts, right? Providing testimony. We're contributors through our tax dollars. And then we also have those who are truly staff to this work, and they're doing the analysis, the heavy work of the analysis and budget prep. So let's keep going, Alex. So this handy dandy slide, we thought, is how this all works administratively, right? So I just want to focus on a couple of things on these slides, and namely, remember that session for us occurs in a bifurcated way. So once every 2 years, it begins the first Monday of the February when session starts. In this instance, it was February 3rd, lasts 120 days. We're not talking about special sessions, but we are 120 days worth of session by law. As I mentioned, those are the 63 lawmakers, and that we have a sine die of June 2nd this year. That Legislative Council Bureau, as I mentioned, is really, really important. This is a group of individuals where concepts get moved from the idea category or bill draft resolutions to reality. They do the heavy work. They help to move adopted law into codified statutes, and sometimes it's necessary to have regulations to support statutes. And regulatory development is another beast in and of itself, but our Legislative Council Bureau champions help us make those concepts realities. And also what's interesting is their staff is full-time. Just keep in mind. So if you know a policy analyst, sometimes they're the best person to know. They're there year-round and are full-time staff. And then the last box talks about state agencies. So Department of Health and Human Services is named in so much legislation, right? And after Cindy die, work is still being done. We are, if named, lifting and actioning the components of legislation. So next slide. And this is our slide that talks about how policy becomes law. We kind of refer to it as the schoolhouse rock of all of the instructional topics of conversation. And I think because we're looking at some time crunch. I think we've lost our ASL. If we could let the record show that our ASL interpreters have dropped off. The life cycle of legislation. So just kind of moving our way left to right and doing it as succinctly as I can. Everything starts with an idea, right? And that idea can come from anyone. It can come from a governmental official, an elected official, a business, an organization, a mom, anyone can start the ball rolling. It's first introduced in either one of the houses, the Senate or the Assembly. It's given a number. It has a first reading. It's assigned and printed, and then it's delivered to a committee. Now, when the bill is in committee, various things can happen. Recommendations are usually what takes place. And once it's recommended that the bill pass, it either does so as is or with amendments. And if it's going to move forward, it then could be placed in the second reading for the next legislative day, if it doesn't move forward, I'm sorry. And then the committee can also indefinitely postpone something, which means they take no action on the bill. Also, a part of this process is something we call due pass. And that's when we start talking about the additional readings, the second reading, and how these recommendations and bills are moving through. And sometimes they're amending without, and there's no passage. So bills at any point in this process can die. It makes it for very interesting policy making and for processes to track, which is why people are actually paid to do this. It is a very difficult process to keep up on. But by the time a bill reaches its third reading and debated, there's typically this vote, right? And if the bill passes in the House of Origin, it then has to go to the other house. And then these steps are repeated. So if in that second house, it then is passed, it goes back to the House of Origin. Now, once it has again passed both of these houses, it is then sent to our governor. So the governor, as I mentioned a few statements ago, has a couple of options, right? He can sign it into law, he can veto it, or he can move to not take action at all. So that is our process. As inglorious as it may be, that's the sausage being made. You can definitely, if you want to have this as a reference guide, find it at the Nellis Research Division's section of their webpage, and it's a good desk reference. So now let's shake off all that and just kind of focus on what did NOMHE look at, right? What did we track? What is of importance to our particular activities? And there we are. And so we were able to identify bills for a couple of reasons. One, did a bill name NOMHE as an agency that is going to, again, lift components of it? Did a piece of legislation impact a population that's important for NOMHE, one that we advocate for? Or did it have broad or indirect implications to just general wellness of the community? Impacts, or for example, impacting our public health infrastructure, since that is something that we track and monitor now. Internally, staff was assigned to listen to committee hearings. We populated an internal spreadsheet for documentation purposes, and that's what we use to generate this particular report. I believe as of last night, there was 1,210 bills. We tracked 126 throughout session. And as I mentioned, Nellis, the timing of the Nellis final updates in the bill status. Well, given that the governor still has several days left, we're going to still wait and see what are the final subset of bills that become law. But we still are able to have a discussion, and we can move to the next slide. To make this more manageable, we further created and kind of bifurcated these separate categories. So we were using them to filter and process information. For example, you can see several things on our spreadsheet that we use when we were entering the 126 bills. Obviously, some of this is self-explanatory. We track the number, the title, who the sponsor was. But there's some not so standard filters that everyone uses. NOMHE also uses a filter we call the Health and All Policy Principle. And if you remember, Health and All Policy is defined as that collaborative approach that integrates health considerations into policymaking and programming across all sectors and at all levels. And we do this so that we can improve a community's wholeness and wellness, right? Its basic premise is rooted in the understanding that health is not solely determined by the health sector. And a really easy way to think about health and all policies is to think about this. It's a phrase I have written on my wall, that to live, it should not matter where you live. So when you think about that. So we are now looking at how we're going to keep reviewing legislation. We asked a couple of questions under the HIAP example. And after we ask these questions, we now are moving into the next slide. And these are the bills that we want to present to you today. As of June 2nd, the following subset of bills were passed out of the legislature, and they were tracked by NOMHE. And if we could go to the next slide. AB 165, out of the Committee of Natural Resources, it established an outdoor educational council and set forth duties and membership requirements. Why was it important to NOMHE? Well, the ability and access of outdoor recreation is important for health and wellness, right? And many are not able and or aware of the many ways to engage with the outdoors. So that's why this is a bill. While it doesn't name NOMHE, we do work oftentimes with the Department of Outdoor Recreation. We were instrumental in them creating their 17 minutes of wellness. Outdoors for 17 minutes has a very healing effect on us. So that's why we're very much mindful of this bill and very glad that it did, in fact, pass through session. Next bill, or next slide. SB 266. So this one defines the definition of provider of healthcare within the state student loan repayment program. And why it's important to NOMHE is that it expands routes for health provider workforce growth by providing a financial way to ease the cost of graduation education. We do a lot of work through the state's Silver State Health Improvement Plan. There's a very intentional track in our state's improvement plan that talks about diversifying our workforce when it comes to health. So this is all interrelated, and we're very involved in that effort as well. Our next slide. So then other bills that address public health infrastructure. There are several here, and for the sake of time, I'll definitely mention their numbers and do just the essence of the bill. AB 36, it modified requirements for providers of services under Medicaid. AB 56, it modified continuing education and licensure fee requirements for medical providers. AB 60, modified peer recovery support and certified prevention specialist service practice requirements. AB 262 modified the graduate medical and postdoctoral fellowship program. That was very important again because of our workforce diversification work. SB 171 enacts a shield law for healthcare transgendered persons. SB 408 revises provisions related to county hospitals and hospital districts. Our next slide. Additional ones that were passed through session and are really relevant under the more broad category of determining factors of health. AB 26, regional transportation considerations. AB 55, related to motor vehicle crashes. And some of these are very important to us because we, as I mentioned, are now moving into the public safety space, providing an equity lens to considerations on vulnerable road users in particular. AB 96 modifies requirements for heat mitigation. We have been working with the Office of Analytics for 3 cycles now on the state's minority health report. And we, every cycle, try to imbue additional considerations and reporting criteria and indicators. And one that we were not successful with was the effect on health that comes along with heat exposure. But we think we'll be able to change that now because people are recognizing that more and more. SB 113 revises provisions related to parking privileges for persons with disabilities. And then SB 405 creates the Transit to Trails Task Force. This again is an outdoor related activity. NOMHE serves with the Department of Outdoor Recreation as it updates its actionable plan called the SCORP. And the SCORP is updated every 5 years. And so having this piece of law behind that update is going to be very instrumental. And next slide. And again, I'm going to keep going, everyone. As of sine die, the following few examples are bills that did not pass out the legislature, but we still track them. And the reason why it's important to bring these to your attention is just because they did not pass through legislature does not mean that you within your own sphere of influence cannot pick up certain provisions and still try and action them, right? Or that these bills cannot come back next session. So we still want to put this on your radar. Next slide, please. SB 192. This one is a huge one. It's got a lot of content. It was kind of referred to as an omnibus bill, but in essence, it requires that hospitals or freestanding birthing centers take certain actions in order to notify patients in a way that ensures their accessibility. It requires that children that are placed within welfare services be assessed and diagnosed for mental and behavioral health conditions. And it requires that medical boards adopt certain regulations based on some race health formula creation. Nope, you can go ahead, Alex. Has a component that speaks to health insurance coverages, in particular, talking about hormone replacement therapies being recognized and that doula services be recognized. Again, we know why that's important. And then lastly, it talks about our medical schools and some of the other licensing boards and resulting disparities and how to address those. Next slide. SB 352, it prohibits public and private policies of health insurance and healthcare providers from discriminating against any person. That is obviously something that is within our wheelhouse and fits within our mission work. Next slide. Almost done, everybody. And so there are other bills that, again, are addressing general health or our public health infrastructure that did not pass, but that we behoove you as members of this advisory committee to keep on your radar and find ways to keep alive its intentions, if not to bring back during next session. But SB 250, related to healthcare records, electronic in particular. SB 423, it's a general policy on public health. This is leading us up into 2 that there's a bit of confusion, let's just say that, with SB 494, which was the governor's bill that was introduced very late, and SB 495, also one of the governor's bills that was introduced very late. And this is one that, and there was conflicting information, but we wanted to at least put this out there. Components of it appear to be moving forward. For example, 494 is that bill that is provisioning that of the Department of Health and Human Service, that the agency responsible for Medicaid be broken out and a health authority be established. And then 495 provisions that certain activities be moved under that health authority. So it's kind of clear as mud right now. Wanted to share it with you. We can feel free to discuss offline, feel free to track it, but those are two very important bills. Wouldn't be surprised if special session comes back and we hear these again. SB 246, health insurance coverage for gynecological and obstetrician services. SB 247, health notes. We were very disappointed in seeing that this did not make its way through the legislative process and result in a bill. We have been talking about the importance for health notes for quite some time. It is somewhat believed that we just ran out of time in this legislative session. That it's not that some of these bills weren't meritorious, that we literally they ran out of time. But that is one that NOMHE has been advocating for quite some time. AB 399 requires that certain health insurance cover things such as severe obesity, and that is a health determining chronic disease as well. So our next slide. Others that are addressing social determinants of health, SB 474, about food security, SB 217, about reproductive health care, and SB 233 talks about urban agriculture. Food security is another one of those areas where NOMHE is now leaning into because it has relevance across the state, and in particular with our rural communities. And our last slide is, do we have any questions or points of discussion? I know that was a lot, Mr. Chair, but hopefully it gives you a lot to think about.
No, absolutely. Thank you so much, Ms. Dorch, for your updates there. I am seeing one hand raised from Angie Wilson. Please proceed.
Yeah, Angie Wilson for the record. I thank you for the overview. You know, this whole process for the state legislature is so new to me. I usually don't you know, deal with that. I'm usually presenting to tribal leadership, so this has been very helpful. But I am also happy to report from the tribal side, we've gotten some wins on that side, and I just wanted to mention them really quick. And the first one was Senate Bill 97. Senate Bill 97, through our advocacy, establishes a permanent tribal representative on the Silver State Health Insurance Exchange. And that is really specifically because there are provisions in the law that are very specific to American Indians and Alaska Natives who are enrolled in federally recognized tribes. So we fought for a long time to be able to get a permanent seat on that as a result of that. So we're excited about that. Governor signed that, and it's official. The other one is Senate Bill 312, which I'm so incredibly proud of. I've never drafted a bill before, so this was my first stab at it, and I'm so appreciative to Senator Donate and the Senate Committee on Health and Human Services as they picked this up as one of their BDRs, and this has made it all the way through the process. And what this does is it establishes a formal Tribal Health Authority Council here in the state. And along with that, it establishes, I believe, better communication between our tribal clinics in the state, better partnership. It also allows our clinics to do presumptive Medicaid eligibility, which has been something we've fought for a very long time. It also gives the council 2 BDRs each legislative session. So we're very excited about this effort, and it took a lot of advocacy to get it to that point, but very appreciative. And we're working on the final date here soon to have Governor Lombardo will be hosted here at the Reno Sparks Tribal Health Center to sign that. Sign SB 312. So we're very pleased about that. So we just wanted to mention those to you so you can, you just know we're very excited about those.
That is so amazing. And you can't state enough how important having the BDR power is. Congratulations. And you said this is your first outing. That was amazing. Amazing. Is that going to be a component of the new health authority?
Well, you know, I'm not really sure. I think we were surprised with the new, with SB 494. So I don't know where that will be, but I'm sure that they'll have discussions with that. What it will do is it will have a quarterly meeting, and in that meeting, it will the new Tribal Health Authority Council will be comprised of not only the voting members, of course, being the directors of the tribal health clinics in Nevada, but non-voting members would also be a representative from the Indian Health Services, our Nevada tribal liaisons from every single Nevada DHHS division, and then minority and majority representation as well. So I think there's a lot of opportunity in the future on this to really evolve. And I would just say this, I was very surprised to see a lot of the support from agencies here in the North and in the South reach out, especially being able to have an avenue to address the tribes in a more formal way. Because I know sometimes it's been difficult to have outreach to some of especially the rural or frontier tribes. So we're really excited for that to happen. So I'm assuming at some point in the future, it'll be identified somewhere in there. But we're very excited for it.
Thank you so much. Mr. Chair, I see that we have two more hands, and I will ask, unfortunately, if we can be really brief in our comments. I'm so sorry, but we have, a lot of us have another meeting we're supposed to be in. It's amazing. But Angie, that's so amazing. Congrats to you. Maggie, it looks like your hand is first, and then Nancy.
I just have two very quick questions / comments. So one of the bills on your list, which was, I believe, SB 171, I did see that it was vetoed by the governor. I'm just curious as to were any of these communicated to him in terms of like, hey, these are some bills that we're looking for that would be helpful. I'm just trying to figure out what the strategy and if we could have been helpful in any way, shape, or form. I know some of these subjects are very, very political and are often better carried by the members of this advisory committee than staff per se. And then my second question is, I know that the bill for the reorganization of your division went through. I'm just curious as to when is that transition starting? I don't know that I was following that through.
Well, I'll answer your second question first. And it is, I've said this phrase so many, clear as mud. I'm going to be very honest. We are so on the very early stages of sine die, and they were working and voting and making amendments up until very close to midnight. So I do not have an answer, Maggie. I wish I did as far as next steps on that. But trust me, we're not the only ones that are asking the same question. And as far as like input and how to effectuate change, you're right. It is not something that as a manager of a program, as departmental staff, that we can advocate in that way. But as advisory committee members, you're always available and able to advocate. You are members of the public first and foremost.
Thank you.
And Miss Nancy.
Real quickly, I just wanted to say that there were two bills. Well, we were following several bills, but there is a bill that passed SB 207, which is for the PACE program, which is the Program for All-Inclusive Care for the Elderly. We have several of our federally qualified health centers that are interested in starting those programs, so we're excited about that. And of course, federally qualified health centers, as you know, target underserved populations and vulnerable populations. So we're happy about that. And the other bill that we also supported, 262, when that passed, as Tina already talked about, and SB 300, which is allowing for certified professional counselors and licensed alcohol and drug counselors at FQHCs to be reimbursed, which is great. That'll support the behavioral health and the substance use disorder work that is being done in those organizations. So I just wanted to share that.
Thank you so much. I have taken note of that, and we can make this available if anybody wants the full report. It's an Excel spreadsheet, and we just didn't want to share it that way because it will make your eyes cross. But we can help walk you through it, and all these things and everything is there. The filters I talked about, it is a wonderful resource. Kudos to Alex for maintaining it. And if anybody does want to see it, we can make that available to you. I just want to say there, Alex is going to be mad that I said that, but we can make it available.
This
Angie?
is Nancy Bowen. I would love to see that. So.
All right, gotcha. I'll note that, Nancy.
Angie Wilson for the record. So sorry, you guys. I'm going to have to jump off the call. I have an event starting downstairs I need to be at. So I'm going to have to jump off right now. So sorry about that.
We understand. We are getting dinged too because we're supposed to be presenting right now. It's crazy. Miss Howard, how are you today?
I'm well, thank you. I just wanted to see the SB 192 first slide again.
SB 192. Alex, can you go back?
And while you're looking at this, Reverend Dr. Deborah Whitlock, for the record, I'm going to have to go ahead and jump off as well. See you soon.
Absolutely. And
Okay.
what we'll do then before we answer your question, Ms. Howard, Mr. Chair, we can handle the business of agenda item 8 through the staff can do a doodle poll to just look at, topics, and without making it a meeting, just to see meeting availability, we can handle that. But we do have to save a moment for public comment. We must do that.
Absolutely.
Completely
So
understandable. Thank you.
And I'm sorry, Ms. Howard, your question was?
I just needed to see the slide. So you
Oh.
did that. Thank you.
Okay, there you go. All right, Mr. Chair, if you want to take us to agenda item then number 9.
Wonderful. And thank you so much for the information as well, Tina. I sincerely appreciate that, Ms. Dorch. With that said, we will go ahead and move on to public comments. So I'll go ahead and go through this, and then please chime in if you do have any comments. So public comment will be taken during this agenda item. No action may be taken on a matter raised under this item until the matter is included on an agenda as an item on which action may be taken. The chair and the advisory committee on minority health and equity will place a 2-minute time limit on the time individuals may address the committee. The chair may elect to allow public comment on a specific agenda item when that item is being considered. To provide public comment telephonically, please dial 775-321-6111. Anytime after the chair announces the period of public comment. When prompted to provide the meeting ID, please enter 493-836-655#.
Alex, if you can help me, as always, to scour all of our bells and whistles and portals to see if we have anyone by telephone or virtually who would like to give public comment.
Alex Neal for the record at this time. No, there's no member of the public with their hand raised, and no one who has joined or is joining to the call right now by phone.
Thank you so much. So we are hearing and seeing none. With that said, we'll go on to agenda item number 10, which is adjournment. So with that said, are there any last points of discussion from any members of the advisory committee at this time? Hearing and seeing none at the moment. Please communicate any additional thoughts that you have for additional meetings to NOMHE staff directly via email. I know that we are looking for those, and it sounds like Alex will be sending out a doodle poll for additional meetings in the future. So thank you for that as well, Alex. With that said, I'd like to ask for a motion to adjourn our meeting today at 12:30 p.m. Do I hear a motion?
Bishop Bonnie Radden for the record. I say let's adjourn.
Thank you so much, Bishop Bonnie Radden, for that. Do I hear a second?
This is Nancy Bowen. I second the motion.
Thank you so much, Nancy. So with that said, motion carries. One second, actually. Let me all in favor of moving this motion forward, please say aye.
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 All opposed, please say nay. Hearing or seeing no opposition, now the motion carries. Thank you also so much for your time. We appreciate your input as well as the NOMHE staff participating as well. Thank you so much, and have a good one.
Thank you.
Thank you.
Thanks, everybody. Bye.